Welcome everyone to California WIC Association's WIC Works webinar. Today we're going to learn about millennials in WIC, reaching today's young parents. My name is Margaret Allman. I'm the Communications Coordinator for the California WIC Association, and I'll be your moderator today. We have two presenters, Maggie Rasnick from CWA. She's worked as an intern with us and is consulting on this webinar with us. And Kevin Watanabe with the Arizona Department of Health Services, and you'll learn more about them shortly. We're glad to have you all with us today. Just a note about how we're going to handle questions. We will wait till the end of the webinar to answer your questions. Please type them into the question box on your control panel, as we've had to mute everyone in listen-only mode just because of the volume of people we have attending. Be sure to press send, of course, and we'll screen the questions and direct them to the proper presenter, and hopefully we can answer your questions. Just a reminder that a webinar recording will be linked on your follow-up email, which you should receive tomorrow. And the presenter slides are already or will be on our website at this address, calwic.org/events. For those of you who are wanting to earn an hour of continuing education today, registered dietitians and lactation professionals, remember that you must have registered in advance. If you're listening with a group or on a computer that you did not use to register, you need to send me an email to document your attendance. You also need to attend the entire webinar, and then we will send you a link to an evaluation on SurveyMonkey in tomorrow's follow-up email, and we'd like you to complete that. In fact, you need to complete that, especially if you're a lactation professional, for continuing education credit. And then we'll send you a certificate email once we've verified that you've done all these things. And unfortunately, with our very small staff and moving our office next week and the holidays coming up, it'll probably be a few weeks before you get a certificate, so we appreciate your patience. Now I'm going to turn it over to Karen Farley, California WIC Association Executive Director, and she's going to introduce our panelists.
Thank you, Thank you, Margaret, and thank you everyone for attending. Thank you, Maggie and Kevin, for participating with us. And I just wanted to mention that on our website is a paper that is a companion piece to this webinar, My WIC, Updating WIC for a New Generation, a paper we're releasing with this webinar. So along with the slides, you'll have that material also. So we are thrilled that Maggie's able to work with us on this webinar. Maggie's a graduate student at University of California, Berkeley, working on her master's in public health and the requirements to become a registered dietitian. But she has a long history of working in nutrition education, both in the U.S. and in Peru. And here with us, related to engaging families, she created a toolkit for inclusion of men and dads in WIC and social service programs that is on our website, and also another related program, inclusion of African Americans in the WIC program. So we're thrilled that Maggie had some time to work with us, and we think you'll be interested to hear what she has to say today.
Thank you, Karen. I'm just getting over to Maggie's slides now. I just wanted to respond to somebody's question already, and they said something about background music. Is that still a problem? I'm not hearing it at all in my audio. If it's still a problem for you, can you please say something in the question box? It may have something to do with somebody's phone being on hold. If you are listening by phone, please don't put your phone on hold. You should be muted, but just checking on that. Thank you. All right, looks like it's resolved. Thanks. Pretty soon you should be seeing Maggie's slides. There we go. Thank you, Maggie.
Okay, sure. I was just figuring out this last part here of seeing my notes at the same time. So if you just 1 second and I will have that.
We lost the view of your slides, Maggie, so I will, oh, we lost Maggie altogether. Oh boy. All right. Thanks for your patience, everyone. We've just got a few technical difficulties here. Yeah, we lost Maggie's connection, so do you have a way to contact her, Karen, or should I email her?
I'll reach out to her.
Okay. Oh, she's getting back on now. Hi, Maggie. Are you with us again?
I'm with you. I'm sorry. I'm totally not holding up my end of the bargain of being the millennial who's good at technology. I need everything. I'm sorry. Okay. So I'm back if you are.
I will make you the presenter. Here you go. Looks good.
Okay. Today we'll be talking about millennials and WIC and reaching today's young parents. So the millennial generation has come of age and is now parenting. So our objectives for the webinar today are that by the end of the webinar, attendees will be able to describe aspects of the millennial generation that have been found in market research, identify ways that WIC application enrollment or certification could be modernized or made more efficient, identify organizations outside of WIC that could provide strategies for modernization, list places where WIC participants might work, live, or play that could be a new location for WIC services, and describe how they might advocate for modernization of WIC services, and describe actions local agencies might take to work on modernization of WIC services for education, application, enrollment, or certification. Okay, so what do we know about millennials? So let's start by asking what you know, those of you out there on the webinar, to be true about this generation. So feel free to type in a brief comment of what you know about millennials. Okay, so maybe Margaret can see comments that I can't see, but I am not really seeing any right now.
I'm happy to read some of them too. They have cell phones. They love their smartphone. They have student loan debt. They are digital natives. They're tech savvy. They want to talk, not text. The internet has all the info. They use many social media platforms. They don't like to talk on the phone. Let's see if there's something that they're having children later, the professional millennials. They're not getting jobs of choice. They want individualized information. They listen to their friends versus the teacher. Peers are important more than experts.
Yeah.
A third of them would rather go to the dentist versus having to call someone on the phone. I like that one. There you go, Maggie.
Yes, thank you. Okay. Yeah, so a lot of those comments do sound kind of familiar. So millennials are typically defined as the group born between around 1980 and 2000. So they are older teens and up to about age 35. They make up 25% of the current U.S. population. Already 1 in 4 are parents and 53% live in households with children. They're very ethnically diverse. About 43% of millennials are non-white, the highest proportion of any generation. And this generation is very digitally connected, and they tend to be constantly engaged with mobile social media. So market research describes this generation as highly connected and opinionated. As millennials, we expect a fast response, which some marketers call impatient. Millennials want personal and emotional benefits from their products and services. They rely heavily on their peers when deciding to participate in or consume goods and services. They also want to have a feeling of ownership and direct participation. Due to the splintering of mass media into thousands of smaller channels, reaching this generation involves a more personalized, micro-targeted approach. More than 90% of millennials are regular internet users using a combination of smartphones, tablets, and laptops to access the web for everything from shopping to entertainment, news, social media, and personal business such as banking. Contrary to some common assumptions, research shows that current WIC participants are just as wired as the rest of their generation. In 2011, USDA Special Project Research looked at how WIC households in the western region states, including California, use social media and the internet. Nearly all participants owned cell phones with texting capabilities. The 3 most utilized technologies were email, Facebook, and text messaging. Not surprisingly, younger participants were more likely to use their phones to connect, while older ones still used computers. And more educated WIC moms were likely to use the internet to schedule or change WIC appointments or to log on to online nutrition education or videos. The same research showed that participants are eager to interact with WIC online rather than having to use the phone or schedule in-person appointments. Participants also want to receive more nutrition education via online classes, take-home lessons, and video chat, and they're open to connecting with each other via social media. Participants reported they're already using parenting and health sites such as parents.com and babycenter.com. So what do you think this information means for the WIC program? Feel free to type in a brief comment.
All right, this is Margaret, and I'm reading your great contributions. Thank you. One is, our old lessons plans just don't cut it anymore. We need to be more digitally connected, make scheduling available online, less paper, efficient ways to receive services online. We need a WIC app. We need to embrace this way of thinking for our participants as well as our local agency staff. More social media, virtual peer groups, cards rather than checks. HIPAA needs to catch up as well. ability to do certification by telehealth. Interactive nutrition education pieces. Depend on technology, which not all people are savvy with. Those are great contributions, and just so you know, these will all be as part of our record, so our presenters and those of us at CWA working on these issues will be able to go through these again. So we really appreciate you typing in, and we'll have a record of it, and it will be informative for us in the future. Thank you.
Thank you for all of the comments. So now outreach or marketing WIC benefits and services to new millennial parents is, as you are all acknowledging, much more challenging than simply placing TV or radio spots or buying billboard or bus placard space. It means penetrating a potential WIC participant's unique social and cultural bubble via multiple media platforms such as Twitter, Facebook, and Instagram, creating a relationship that will cut through the clutter and engage a new mom or dad in a program that feels individualized. Given that millennials are so digitally connected and want personalized information, WIC will need new approaches to support them around healthy nutrition and breastfeeding. Market research finds that this generation values peer or friend support. They believe parenting is an equal partnership, and they want authentic and useful learning experiences. They like to feel directly involved in their own learning, not passive recipients. So keeping WIC relevant and appealing to this group could mean moving service delivery beyond the traditional fixed WIC site, the medical outpatient model, to a more individually tailored My WIC experience in the virtual space. To continue to attract and retain participants from this tech-savvy generation, WIC will need to consider transforming its current business model. By 2020, all state WIC programs will have transitioned to electronic benefits transfer, EBT cards, for WIC food benefits redeemed at local grocery stores. The WIC EBT rollout is the perfect time for other parts of the program to modernize as well. A WIC redesign should feature three main components. First, addition of options for secure online virtual WIC enrollment, certification, and benefits issuance. Second, creation of internet-based nutrition education and breastfeeding support technologies, and these that can reach WIC participants in their homes, on their phones, and whenever they need it. And three, transformation of the current WIC workforce to provide WIC benefits and nutrition services in the virtual world as well as in person. Today, WIC serves millions of participants from thousands of local sites across the country using the traditional outpatient medical model. With rare exceptions, WIC requires that participants come to local sites in person, present income and medical eligibility documentation to WIC staff, and be assessed for weight gain, dietary intake, and anemia status. After initial enrollment, most mothers must come in every 6 months for in-person recertification appointments, annually bringing in infants and children who have previously been enrolled. An online application and eligibility determination process, such as is now used for SNAP, CalFresh in California, would enhance access. WIC can learn from innovations already implemented in SNAP, which has greatly streamlined the eligibility process using telephone interviews, uploading required identification, income, and medical documentation to a secure website, and smartphone sharing of this type of documentation. Horizontal integration using shared electronic medical record information to obtain anemia test results would greatly expedite one of WIC's most cumbersome eligibility requirements. HIPAA and WIC confidentiality rules should not hinder innovation in this area. Healthcare has moved ahead in the use of telemedicine and successfully overcome these perceived barriers. Beyond certification, the minimum requirement for contact to provide individualized WIC nutrition education is 4 times per year, but more frequent contacts are common, especially for pregnant and breastfeeding women. Many of these participants visit WIC every month, Okay, sorry, I thought maybe internet cut out for 1 second. Many of these participants visit WIC every month to have their progress checked and to attend group classes or receive individual counseling or personal support from WIC staff or peer counselors. Other women, particularly postpartum, non-breastfeeding women with older children, often get 3 months worth of food benefits at a time and come in only for recertification and required nutrition education contact. Surveys and focus groups suggest that the majority of WIC participants have mobile phones or computers, and there is interest in having more online options available, such as a WIC-related app. In recent years, WIC programs around the country have developed evidence-based online nutrition education platforms, which most states now offer to participants as an alternative to in-person classes or counseling. Participants can choose to log on and work their way through learning modules on a variety of topics, from breastfeeding to salt intake. They then take and submit a post-test online. These online offerings have been well received by participants, with studies showing high acceptance and effectiveness. Other online options are being used for breastfeeding support. WIC programs could augment these offerings with virtual counseling sessions using video chat, interspersed with text or Twitter reminders, and other digital interaction. More and more programs are using HIPAA-compliant secure texting of WIC appointment reminders and well-timed nutrition or health tips. Some are experimenting with telephone consults, video conference meetings, and using Skype or FaceTime for WIC counseling. An updated WIC program should include targeted group support for pregnant or breastfeeding moms, coordinated via Facebook or even Twitter meetups. Many tech-savvy WIC moms already use specialized applications to support them with breastfeeding challenges. Although busy and stressed WIC parents and caregivers have responded favorably to these virtual health education options, the WIC organization, often the sponsoring agency itself, can be the biggest barrier to innovation. Rules often forbid employees to use social media, and there may be fears of violations of confidentiality. However, many hospitals and community health providers have found ways to comply with strict HIPAA rules around patient confidentiality and still take advantage of these innovative communication technologies to streamline and simplify interactions. So building an online WIC platform does not mean abandoning traditional in-person service delivery. Personal contact between participants and staff is a hallmark of WIC and should continue to be an option. Private interviews usually take place when participants enroll or receive periodic screening and counseling at local sites. These brief conversations are a chance for young parents to share concerns and for staff to visually and clinically evaluate individual health status, provide specific advice, and other referrals for additional mental health or social services support if needed. The personal aspect of WIC service can literally be life-saving, as when a WIC staff notices that an infant is dangerously dehydrated, a child is bruised, or a mother is severely depressed. Moreover, many WIC participants still prefer to come in for appointments and talk to their WIC counselors in a safe and personal environment. Others do not have access to the technology needed for online contact. For the majority who do have online access, WIC communication can enhance the important in-person dialogue by allowing further contact and follow-up between visits. WIC can keep up an ongoing dialogue with parents using teaching videos, personalized messages, and answering questions in real time. WIC participation rates drop sharply after infants turn 1 year old. At that point, the household transitions to the child food package, which carries a much lower retail value than the infant formula package. In a 2010 USDA WIC attrition study, 26% of households exiting the program reported that it requires too much effort and time for the value of the benefits received. And nearly 10% of those exiting cited scheduling and transportation problems, suggesting that the overall transaction costs or the overall hassle of WIC participation may be a barrier. Once WIC EBT cards are universally available, WIC can focus on overcoming these transaction barriers by testing ways of providing benefits and services where parents work, shop, or spend time together, instead of at fixed standalone WIC sites. Less cumbersome and more mobile technology will make it easy to issue benefits, allowing flexible and innovative alternatives to current operations. At the same time, providing and documenting WIC nutrition and breastfeeding services to participants could be liberated from being solely offered at the WIC office using technology or creative community partnerships. Most WIC sites are already co-located with community or public health clinics, but city parks, daycare centers, school health clinics, grocery stores, pharmacies, or retail outlets might also be attractive as places for young families to receive WIC benefits and nutrition services. WIC providers could issue food benefits at grocery stores, malls, or factories, work with breastfeeding moms in pharmacies, where breast pumps could also be issued, or share nutrition education messages and cooking classes at daycare centers or playgrounds. At the same time, WIC participants could use personalized WIC apps and other social media platforms to shop for WIC food, get help with breastfeeding, or discover new ways to feed a picky eater. So now it's time to plan for my WIC. To appeal to the young parents it's seeking to serve, WIC needs to reposition itself as a high-tech, high-touch program. High-touch meaning that WIC has a close and personalized relationship with its clients. WIC managers and advocates must begin updating WIC to meet the needs and aspirations of the millennial generation. This is a tall order, one that will take many years of innovative state-level WIC modernization pilots, considerable federal regulatory overhaul, and enhanced federal funding for systems redesign. The process can begin with pilot testing using federal waivers and public-private funding partnerships. Pilots that evaluate well can be scaled up using policy proposals during the next Child Nutrition Reauthorization debate of 2020. Failure to take action will result in an increasingly outdated and unpopular program with dwindling utilization and political support, which is an unacceptable outcome. So our policy action recommendations are that USDA and state WIC programs should include redesign of WIC nutrition services, breastfeeding support, and nutrition education at the same time as they plan and implement new MIS and EBT system rollouts. Second, USDA and state WIC should review and update WIC eligibility regulations and guidance to reflect cutting-edge technological advances in secure document handling, database linkages, and other online identity and income verification applications in order to streamline the WIC certification process and decrease the number and length of required in-person clinic appointments. Third, USDA and state WIC should review and update WIC regulations and guidance to allow for innovative online and social media approaches that are as effective as personal counseling and group classes and easier to access in order to create virtual options for nutrition, education, and breastfeeding support for busy working families. Fourth, WIC advocates should work with USDA and state WIC to ensure that the pending child nutrition and WIC reauthorization statute is passed with language allowing USDA waiver authority to conduct and evaluate pilot programs, testing new approaches to WIC education and service delivery using these innovative and emerging technologies. Number 5, based on the outcomes of pilots, WIC advocates should work with USDA and state WIC to seek more substantive changes in the 2020 Child Nutrition and WIC Reauthorization Statute that will allow states to redesign basic WIC services to include both in-person and online options for certification, benefits issuance, and nutrition education and breastfeeding support. Number 6, USDA state and local WIC agencies should begin rethinking and redesigning staff recruitment and training programs to reflect the new skill base needed for a high-tech, high-touch WIC program. So here is information of where the webinar recording will be available and how you can sign up for the Flash newsletter. So Margaret, I think it's to Kevin now.
Yes, thank you. This is great. A lot of people have been asking where can I get all this great information that you presented verbally as well as the slides, and it is all on our website, and at the end of the webinar I will give you a link to that. It will also be in your follow-up email. So Karen, if you want to say something about Kevin as our guest speaker, we're so glad to have you guys with us. I'll switch over to Kevin's slides.
Great, thank you. Thank you, Maggie. Yes, there is a lot of information there, and you will have the slides and the issue brief that are on the will be on our webpage. So thank you, Maggie and Margaret. So now it's my pleasure to introduce Kevin Watanabe, who has been very helpful with us, CWA, as we try to learn about technology options and early adapter projects that are looking at how to better serve WIC participants. So Kevin was born and raised in Hawaii. He received his Bachelor of Science degree in food science and human nutrition from the University of Hawaii, and his Master's in Science and Public Health from Tufts. He's a registered dietitian, and he's worked in a number of settings, including academia, clinical care, and public health. We met him in his current role as a nutrition consultant for the Arizona WIC program, in which he's going to talk to you about today. He serves as project lead for a USDA-funded project studying online education for WIC participants. So we're really happy that he's able to share about this work. Some of you may have heard him in some other webinars, and we appreciate his time today. In his free time, he enjoys judo, outrigger canoe paddling, and eating, he tells us. So that seems to hook in well with being a nutritionist. So thank you, Kevin.
Thank you. Thank you for having me and allowing me to share about our WIC Special Project Grant. And I appreciate Maggie's presentation because I think that's a perfect segue into the work that we're doing with WIC Online. So I'm going to talk to you today about WIC Online. What is it? What are the challenges? And what are the successes that we've had so far? And I've included here a screenshot, a blurred screenshot of one of our online focus groups that was done as part of our formative research for our outreach campaign, and this was kind of the impetus for our WIC Online project. So in 2013, we did a formative research campaign to inform our outreach campaign that we're doing here in Arizona. And during this research, we found some barriers to participation that WIC clients and those that have never participated in WIC that have identified as barriers to participation. And besides the shopping experience, some of the main barriers that clients identified had to do with transportation, having to haul their children into the clinic, inclement weather, and long wait times. So if you can imagine trying to bring 4 children on the bus in 110-degree weather in Phoenix, and then having to wait in the clinic, that's one of the main barriers that prevents people from continuing on WIC here. And in our focus groups that we did online, we found that moms really wanted to feel connected to one another, and they didn't really value the education that they received from WIC because it was information that they could have just Googled online. And you'll see here, we also found their use of technology, and as Maggie talked about earlier, a lot of millennials use technology often, or at least sometimes daily. So with that information, we developed this concept for WIC Online, and the idea is to provide secondary nutrition education contact for children and reduce those identified barriers to participation. And so if you can imagine, the client will come in for their certification, their secondary contact would be online, they would come in again for their mid-certification, and then again at 9 months they could do this online education again. And because we're not on EBT yet, checks are currently mailed or picked up in the clinic. So our WIC Online consists of 3 main components. We have discussion guides, and we train our facilitators on facilitation skills. And then we're using Skype as our group video chat platform. And on the right there, you can see a screenshot of us testing Skype here in the office. And you can see we're smiling because this was during better times, and we thought that this was going to be so easy and things are going to work really smoothly. but we soon found out that there's going to be a lot of challenges with this project, and I'll talk about those later. So the discussion guides use projective techniques revolving around a topic. And right now we have 3 discussion guides that we're using. We have picky eating, kids in the kitchen, and activity with kids. So for example, the projective technique that we use in picky eating, we ask moms to picture eating with their kids as a type of movie. And what type of movie would that be? Would that be a horror movie, action movie, comedy? And that really gets the parents talking about their eating experience rather than you know, a simple yes, it's going well, or no, it's not going so well. And once that projective technique opens up the conversation, the facilitator then takes the responses from the participants and redirects any questions to others in the group. So if a mom says that she doesn't know how to get little Johnny to eat carrots, and she's, you know, it's a horror movie because he keeps fighting with the vegetables, then the facilitator would redirect that to the group. So does anyone else in the group have any suggestions for little Johnny and how he can get more fruits and vegetables into his diet? So the facilitator is there just to allow other participants to help each other. They're also there to correct misinformation. So if someone is recommending something that WIC doesn't recommend, for example, putting cereal in the bottle, the facilitator is there to tactfully correct that misinformation. We're also using Skype as our video chat platform. The reason why we chose Skype is because it's free, it's commonly used by our clients, and it's one of the few software programs out there that allows group video. And I believe it's currently the only program that allows group video on mobile devices. And so that's one of the main reasons why we chose Skype. So for our project, we asked for volunteers from our clinics throughout the state. 15 clinics volunteered, and 1 was chosen as a pilot. The remainder were randomized into intervention and controls. So the intervention clinics are doing the WIC Online, and the control clinics are doing business as usual. And then we're just comparing the responses from both of those. So lessons learned from the pilot. Originally our project was called ONEDS, the Online Nutrition Education Discussion Sessions, which, as you can imagine, didn't really make much sense to people. And so that's why we decided to rebrand the project as WIC Online. And so from there we really worked hard to advertise the project. We created buttons, posters, appointment reminder cards with our project name on it. And we learned from the pilot that we needed to gain support from recruiters. So when we first did the pilot, we found that recruiters didn't understand what WIC Online was, and we really needed to get them to understand this project a little bit better. These are just some examples of our poster on the left and appointment reminder on the right. We tried to make it really simple. It just basically says, skip the wait, have a smartphone, tablet, or computer with high-speed internet, join us online. And so it's really just kind of a hook to get participants to ask the staff about the project. This is a picture of Dr. Katie Wilson, Deputy Undersecretary of Food, Nutrition, and Consumer Services, and Rana Bach from Western Region. So they came down to visit our pilot clinic, and in the background there you can see our poster advertising the program. So when we finally trained our intervention clinic staff in November of last year, so our pilot was in September of 15, and we started training our intervention staff in November. We revised it to really emphasize the referrals and making sure that our recruiters understood the program. So we showed a live session of WIC Online, made sure that they understood what was going on, and that they understood what Skype was. And we found once we showed the live WIC Online session, so this is an example of how we were showing it. We did a live WIC Online session. We had a projector showing the staff what the session looked like. We found that recruiters really got excited about the project. Once they saw how it worked, how moms were talking with each other, how they enjoyed the interaction, it got staff excited, and that's how we were able to kind of increase referrals from there. So some of the problems we had, so we Skype, when we originally started the project, didn't have group video on mobile devices. It wasn't released until June of this year. So when it first came out, they said that it would be released in January, February of this year. We've tested it a few times and noticed that it wasn't working on all devices. So it would work on iPhones, but not Android devices. And then we found if we called in with Android and iPhone devices on the same call, we had a lot of problems. And it wasn't really until June of this year that things started working a little bit better. Until then, participants needed a computer and webcam, so it really restricted the amount of people that could participate in this project. We also found that internet was a huge problem in our clinic. So Skype group video requires at least 5 megabytes per second of internet speed, and the pilot and 3 of our intervention clinics were running on T1 lines, which are just 1.5 megabytes per second, which is really slow. We also are running our MIS system for WIC. It's a web-based program, so we found that when we tried to do WIC online in the clinic, it slowed everyone down, and so you can imagine that was kind of a big problem when there were a lot of clients in the office waiting to be seen. We tried to get those clinics updated. It's been months, and we're still waiting on 2 of the intervention clinics to upgrade their internet. So that was kind of a major barrier for our project. Once we were able to get internet upgraded, we found that Skype was blocked on a lot of the county networks. So there's a kind of a security concern for a lot of the IT departments in the counties. And so it was really difficult for us to open up the firewall for Skype. And once we were able to get Skype on some of the computers, we found that even though they had Skype on the computers, we weren't able to update it. So that took us another month or 2 to just get those updates pushed out. So Skype constantly needs to be updated because they release patches and updates. So like when group video was added, you need to have your Skype updated so that that will work. And when IT blocks that, it's kind of a big problem that prevents those group videos from working properly. We also found that clients need to have the most updated version of Skype as well. So again, if they don't have the most current version, you can't do a group video on mobile devices. So a lot of clients thought that because they were using Skype with one-on-one with their family members that they would be fine. They found that they didn't update their phones, so once a third person tried to join the group, they would be cut off from the call. We're also having problems with low referral rates. So like I talked about earlier, we tried to increase the referrals, but we're just having a lot of problems. As you know, people in WIC are always busy with, there's constantly changes in the WIC program, and there's so many other competing priorities within that have to be done in a WIC appointment. So getting that extra referral in there is still a challenge. We developed an incentive plan to try and improve our referrals, but it hasn't really been improving our referral rates very much. We got a great suggestion from another state about trying to pilot in-person and online groups. So the idea there is to have a WIC online group, and then if there's anybody in the waiting room that just needs a nutrition education appointment, we would pull them into that online group in the clinic. So they would be participating with people that are online, and then having a group session together and kind of getting that interest in the online session that way. We had a clinic that was going to start in in November, but they lost a lot of staff in the meantime, and so they have been unable to pilot that in the last month. So we're hoping that in the next couple of months we can try that. And of course, we didn't have enough problems, so we had to have a couple of clinics move. So we had, out of our 7 clinics, 2 of them moved. 1 closed completely. Another clinic lost more than half of their staff. And I didn't include on here, but another, or one of our larger agencies is currently undergoing a RIF. So they had to let go of a lot of their staff that we trained, and they're very short-staffed, and they're going to be hiring a few new staff that we're going to have to train. So in the meantime, they are not really doing very much referrals, and that's affecting our participation as well. But it's not all bad news. So we have some good news. Those that have participated really like it. So you see some of the comments here. Some of the parents said it was super easy, way easier and quicker than coming in. The WIC employee was wonderful. No long wait times. It is a convenient way to hear from other moms and receive or offer advice. I think the doctor's office should have these, and muy practical. So really positive feedback. We really haven't gotten any feedback in our surveys that was particularly negative about the project. We even had one person that said it was very difficult to connect to the group, but then that same person rated it as they enjoyed it and they would try and do it again. So we revised our survey in August because we had some problems with our survey. I didn't include that because that's just one of the smaller problems. But of those that have responded since August, 96% would recommend this WIC Online to their family and friends, and all of them said they enjoyed it. So really positive feedback from those that were able to connect and participate. It's just the problem is trying to get people into the group and try it. So my contact information is there. What I really want from people, if you have any ideas on how we can increase referrals, participation, I would love to hear your feedback because we are always looking for ways to get people to try this. We know that it's a great idea, that people like it. We just need to get them to try it. And so I welcome your feedback. And thank you for letting me share.
Great. Thank you so much, Kevin. A lot of information. I really appreciate your honesty about the challenges you ran into, but also, of course, the positive sides of it. We do have some questions for you, but first, Maggie, I don't know if you can answer this, or Karen, this was a question that came in towards the end of Maggie's presentation. What are some of the pilots that have been executed successfully? I'm not sure exactly what she's referring to, but if you have something to say about that, that would be helpful.
We did a literature search for the paper that you guys did, and that may have been some of the pilots that we were referring to. There are a couple of studies where they tried out some online education and then, asked people what they thought of it, and some people even said that they liked the online education better than the in-person. So there's some research papers that we could share, perhaps. Karen, do you have other thoughts on that?
Yeah, I think there have been a number of pilots or demonstrations for not only online education, but use of technology for appointment management and communications via text messaging, and then just some more innovative uses of WIC staff in the community, working with other programs. So what we're hoping is that as word gets out on these, just as Kevin is sharing on this, that these things can be, more sites can test things and then things can scale. As Kevin was talking, I was thinking about the challenges he's describing, and we've heard some of these similar challenges from WIC agencies in California who are trying to connect across programs through IT. And, WIC at one point had no online presence. WIC staff put all their papers in their trunk of their car and drove them from site to site to serve participants. So we can't let these technology issues become a barrier. We've become computerized. Now we have to take the next step. And some of that is, as Kevin described, the issues with the technology. And some of it is our parent organizations have to support WIC and other programs using more widespread use of technology. So it can be done.
Great, thanks, Karen. Kevin, somebody asked if you could just clarify what a recruiter is. I'm not sure that's a term we use in California.
Oh, so the recruiter is just I don't know what you call them there, but like a NES or CNW, a regular nutrition worker, I guess. The person that does the certification would be the same person that's recruiting the participants for this WIC Online program. So when a client comes in for their certification, when they talk about their next appointment, the same person that's certifying them would be telling them about this option for their secondary nutrition education contact.
Great, that makes sense. Thank you. A couple of people have asked if you have tried or considered Skype for Business, wondering if that might work better.
So we looked at Skype for Business and regular Skype, and there wasn't really a difference as far as the performance. The only benefit that we would get from Skype for Business is the extra technical support, but we really haven't had much success with the customer support from Skype anyway, so we didn't feel like it would benefit our program.
All right, thanks. Somebody else asked if you'd tried Google Hangouts.
Yes, we looked at Google, we looked at FaceTime, JoinMe, Uvu. I'm trying to think. I think we looked at pretty much all of the major video chat platforms, but none of them offer free group video, and none of them offer them on mobile devices. So right now, at least the last time we checked, Skype is the only one that offers group video on mobile devices, and that's kind of one of the primary reasons why we chose Skype.
Thanks for clarifying, yeah. Another question for you, Kevin. Have you run into any concerns from the county regarding HIPAA from the county privacy officer?
I think that was one of their concerns, but our argument was that we're not sharing any, well, WIC doesn't need to follow HIPAA guidelines, and then we're also not sharing any sensitive information in these groups. So the only information that they're sharing typically is maybe like the first names of their children, the ages. We're not really talking about any income information or anything like that on the group calls.
Okay, great. A few more questions for you, Kevin. Let's see. Does Arizona have a process for dual enrollment? That is, when a family applies for SNAP, are they also enrolled in WIC?
No, we don't have anything like that right now. Other than the adjunct eligibility, there's nothing that ties the two together. Okay,
thanks. Let's see. How many people were offered WIC online but did not participate for reasons outside of technical difficulty? Is there a sense of the reasons why people would or did not want to try WIC online?
I don't have the statistics in front of me. I want to say it's about a third agreed to, well, maybe a quarter of them agreed to participate. The other 3/4 say that they either can't or don't want to participate. And then we're going to be conducting focus groups at the end of the project to find out exactly why people can't participate. So we haven't really, our ability to collect that information is kind of limited with our MIS system as far as the referrals. So the only way to kind of weed out the reasons why they don't participate would be conducting a further survey or doing focus groups at the end of the project.
Great.
But we have kind of heard anecdotally that at least in the beginning of the project, people only had phones and didn't have computers, or they had limited data or internet speed, so they weren't able to participate. And that was just the kind of the feedback that we got from the people that are helping to recruit for this project.
So at this point, you know that there are a lot of technological barriers, but you'll be exploring some of the others as well, it sounds like.
Correct, yes.
Yeah, great. Some more questions. Were the online groups at a set day and time, and how often were they offered?
That's a great question. So when we did the pilot, we originally thought that offering the appointments outside of working hours would work best. We found that there was really no interest in the after-hour appointments. I think we offered them 5 times a day every day in the pilot and found that when we offered it too often that we only ended up with one person in each group, which kind of defeated the purpose of having the groups. So we cut them down, and now I think our intervention clinics, most of them have it once a day, maybe 3 times a week, and that seems to be working a little bit better. And I want to say the late morning and early afternoons are the most popular times right now.
Great, thank you. Let's see, is the online education available for WIC participants throughout their eligibility, for example, the 4 years? I'm not sure you know that answer because it's still a beginning project, but what's the plan?
So right now we're excluding infants and pregnant women and people with infants can participate if they have a child. The focus of the 2014 WIC Special Project Grant is child retention, so we're focusing on children. But we're also trying to limit the amount of infants and pregnant women. The reason why we're limiting pregnant women is because we need to collect their weight information. And then the infants, because we need to do the breastfeeding surveillance and following up with breastfeeding concerns, making sure that and that's really a critical time for infants that we felt like the one-on-one education is really valuable during that time. So we are trying to limit the amount of people that participate with their infants. So we're really focusing on children. I don't know if that answers your question. Basically, up until age 5, we're focusing on those children.
Yeah, no, that makes total sense and helps clarify. Thank you. Let's see. Can you briefly describe the incentive plans that you use to recruit for WIC Online?
So the incentive for referrals was just to incentivize the staff to recruit for the program. So we offered, I believe it was like $200 for the clinics that had the most referrals over a set period of time. We found that it didn't really increase our referrals very much, and we're not really sure if that's because of all of everything else going on with the RIF and the moving of clinics and things like that. So we just decided not to continue the incentive program for that reason.
All right, thanks. I'm just reviewing the questions a little bit more. Let's see. Let's switch over to one that might apply more to Karen's expertise, and that is, what can we do to inform our legislators to move regulations into the 21st century for greater effectiveness and efficacy?
Well, I think when local agencies can show some of the, like we were mentioning before, some of the demonstrations or pilots of how the expectations of the young families, they're millennials now, but they'll be called something else in the future, how we can meet their needs and serve people who do need WIC by more modern strategies and tools. Those messages and those examples of what is possible are important. Our goal is to serve people in need and based on their their need for WIC benefits, but we also have to consider what people expect when they use a program, and that has to be as modern as possible to meet the young families that WIC will always serve. So all these examples, like the work that Kevin is doing and the great information he's sharing with us so that people listening don't have to find all that information, they already know that, examples that have happened in other areas with texting and the good responses to texting or online opportunities. All that data is really important to show that that's what participants respond to, and then they get their WIC benefits.
Great, thank you, Karen. Folks, our time is up. There are a few more questions, but luckily we now have a record of them and we can forward them to Kevin. You have his contact information. And if you don't have a way to write it down now, there will be a link to the recording and the slides will be on our website. I'm just going to switch over to a link that shows our where you can find the report that goes along with this webinar on our website. It's at, our website is calwic.org. If you go under focus areas, there's an area that says Engaging WIC Families, and then there's a tab saying Reaching Millennials on the side. So we hope you'll look around on our website. There really are a lot of new resources for this particular population, as well as other subgroups of WIC participants that we're trying to make sure are welcomed and included and served better in California WIC. Karen, did you want to add anything before we sign off?
No, I just wanted to say thank you to Maggie and Kevin and you for running the webinar, and thanks to everybody who joined us.
Great. Thank you. Kevin or Maggie, anything to add?
No, just thank you for allowing us to share.
Yeah.
Great. Happy to have you both. Take care, everyone, and we'll look forward to having you on our next webinar.